Hello, welcome to Wijk TV. I'm Roy Shepherd, and I've been joined by two guests today. We have Tomas Chivato from the University Foundation San Pablo in Spain, and we've also been joined by another Roy. Now, I can say Roy, but I might struggle with your family name, which is Gerth van Wijk.
Something like that.
Something like that. He's being very polite. You're from Erasmus University in Rotterdam in the Netherlands. We're talking here about allergology and how it's becoming more professionalized, and it's becoming a discipline in its own right. So, Thomas, can I ask you to tell me a little bit about why this is happening and why people need to know about it?
Mhm. This is a very important issue because the School of Medicine across Europe not always exists allergology as a subject. And that is very important because all these doctors will see allergic patients during his life. So they need to learn about allergic diseases, causes, diagnosis, treatment, prevention. So it's very important to include in the curricula of undergraduate students of medicine this topic.
Okay, so we've always had allergies, but there's now more of an understanding than ever before. So there was possibly no reason to have allergologists in the past because there wasn't enough for them to know.
You are right. In the past, we were very few specialists in allergology, but nowadays we are a full specialty in many countries, and we have a lot of knowledge to share with the students of medicine.
So why do undergraduates need to have, as part of their medical training in allergology?
That question is crucial because, as you know, allergy is an epidemic. We have millions of patients suffering allergy. When they are practicing medicine, for instance, general practitioners, pediatricians, they will study allergic patients in a daily life. So they must know at least level essential of allergic diseases.
So this is basic understanding of
Basic
allergology.
understanding, diagnosis, treatment, and to understand the disease.
Okay, Roy, your work is in postgraduate. So is that much more detailed allergology learning?
Well, yes, this is what I'm dealing with is with the specialization of doctors already graduated. What Thomas is saying is very important, but not only because students have to learn about allergology, but what we would like to have excellent students who go on with that and will be specialized in the field, like the surgeons, like the internists, like the pediatricians. We need very good allergologists from Iceland to Turkey and from Spain to Norway.
So you are a specialist in the wider understanding of allergology, and you're a specialist in the deeper understanding of
That's
allergology.
correct. A specialist, it is my focus at this moment to get it done in Europe.
Okay, so what would you say the main differences are when it comes to allergology in different countries around Europe? I mean, you're in Spain, but is it the same or different to the rest of Europe?
For instance, in Spain, not in all the School of Medicine, a student receives education about allergy. So when they finish the studies of medicine doctor, if they don't know allergy, they don't are interested in to perform the specialty of allergology. So that's the key.
So basically, you're creating the future supply of students for you.
A continuous way.
Okay, so how is the Netherlands and how are other countries different to Spain, and where are the gaps?
There is a huge heterogeneity. It's huge in terms of duration of training, in duration of the different components of the training. But what is also different, in some countries you have the specialty, in other countries you do not have. In some countries you have a subspecialty, that means you become a dermatologist and then you can have an add-up training in allergy, but then you're not an allergologist, you maintain as a dermatologist. So when you travel across Europe, you will have different situations. And of course, this is also difficult for the patients. They are interested in good care. They don't care about how you call it, the doctors, but they need good care.
All right. So, what are some of the best examples of the curricula for allergology in the different parts of Europe? So, what is good practice or best practice?
Well, we have very good examples, for instance, in the UK, in Spain, in France. But we also, when I speak with people from other countries, training directors, you see that there are different ways to go to Rome. And you can even learn from each other. It's not written in stone how to manage your training. But still, I am very much involved in getting the good criteria. What is a good training? What is a good allergologist? What is a good subspecialist?
So, is part of this when you have the professionalization of allergology that it possibly encourages more people to go into the field?
For sure. If you know allergy, you love allergy. It's clear. Because it's not new, it's an old disease. But now we have a lot of new procedures, molecular diagnosis, the new omics applied for the research in allergology, new treatments with all the monoclonal antibodies. So it's fascinating. But if you don't know, you cannot love it.
So the people that you're talking to or want to talk to, would they not be the people here at the Congress because they're already people that would understand it? Or is there a message that you want to get out to the people who attend the Congress as well? And if so, what would that be?
Mm-hmm. It's important to differentiate because not all the countries are similar. The education is not always the same, but the message is very clear. It's very important to increase the level of knowledge, both theoretical and practical, in allergology, in undergraduate students and also in the postgraduate students.
All right, I was talking to somebody earlier on today who is a student who took a 3-hour allergology exam for Switzerland, and it was compulsory. She had to do it. Is that something you want to see in every country throughout the EU?
Depending on the countries. For instance, in Spain, we have, at the end of the studies of medicine, you can apply for a position in order to be allergologist. In Spain, we're in a very good situation because we are more or less 1,500 specialists in allergology. And we were connected with other specialties because it's not a question of which specialist. Also GPs, pediatrician, also specialists in dermatology, ENT doctors, internal medicine, because we must work together in order to improve the level of knowledge and we will translate to our patients, increasing the quality of life of our patients.
Roy, it seems to me that there are just so many options for people starting out in their medical career now. So what can or what are you doing to encourage more and more people to move into this area? Because there are a lot of disciplines that are really interesting at the moment. There's a huge amount of development in many of them. Yeah. So why allergology?
Well, I think there are different steps. Indeed, you have to be aware of allergology, and that is undergraduate.
Right, that's the first part.
That's one thing. The second thing is what we need in Europe is much more harmonization. So in every place you should have allergologists, you should have a sort of the same training. And regarding the exam where you're talking about, the exam is a sort of method to get harmonization so that people in Switzerland and in Spain speak the same language. And then it is a matter of, indeed, it is motivation. That is a hard job. Some physicians, some students, they are attracted by a sort of ER medicine.
The glamorous, sexy stuff.
Yes.
Or they think when they watch it on TV, yeah.
Yes, but what you see, if you have students or doctors, young physicians, and they are coming in your lab, in your department, they are getting convinced. Well, this is a nice domain. This is a nice piece of work,
But is it more fundamental than that? It's interesting work.
Yeah.
And it's stimulating work
Yeah.
for people, and they know they
Yeah.
will know people who suffer from it,
Yeah.
and very often they suffer in silence because there isn't really either the funding or the interest, because it's not as sexy as the ER
Yeah.
type stuff. So, can you tell me, what do you think is lacking in the present allergology curriculum, and what should be included to make it far more interesting to far more people?
Well, I think this is a difficult task. It is a matter of maybe not. There's not a lack in the curricula. The curricula are quite good, and you can always improve them. But it is a lack of awareness. You have to convince people. We were talking just now. Are we talking to the right people with the IACI TV? You have to convince people outside of this area. So then you have to lobby. You have to lobby to Brussels. You have to lobby to the national societies, to the national countries. Try to solve problems there, and you have to be good. You have to be excellent.
But IACI is doing that.
Yeah.
Not only on this topic, but in many other topics as well. So how optimistic are you that allergology will become a very well-known, very well-respected discipline in, say, the next 5 years?
I don't know if in 5 years, but in 10 years, maybe, because we are fighting in many countries, in many schools of medicine, trying to convince our deans and rectors about the importance of allergology. And very important, patients. Patients are our allies. We work together with the patients.
But you're saying patients have to wait 5 to 10 years.
Yeah, you're right. No, but they can ask, we need a better doctor with knowledge of allergology.
Okay, what would you add?
Well, I'm still quite optimistic. It is an exciting field. There are a lot of developments, and actually we are the expert. We have to cope with other specialists, but it's going better, and I think we should never give up.
Thank you very much. On that note, thank you very much indeed, Thomas. Thank you very much, Roy.
Thank
That's all from IACI TV for now. We'll be back later.